Welcome to episode 49 of the LorainCounty.com Insights Podcast. I'm your host, Ed Skimmon. I want to take a moment to recognize the champion sponsors behind LorainCounty.com: WOBL Radio, Community Foundation of Lorain County, Lorain County JVS, Emerge Inc., and Lorain County Community College. Today, we're talking with Ben Kosewski, President and CEO of Lorain County Health and Dentistry. Join us as Ben talks about the organization's role as a federally qualified community health center providing medical, dental, and behavioral health services. He shares the organization's strategic vision for accessibility and impact, the role of partnerships and funding, and how technology supports patient care. Ben also reflects on his personal journey, leadership goals, and the hobbies that help him stay energized. Lorain County Health and Dentistry plays a critical role in our community. They offer both medical and dental services on a sliding fee scale to those without insurance or with limited coverage. This helps address a major gap in care access for more than 80,000 Lorain County residents who are uninsured or underinsured, ensuring that many children and adults aren't forced to skip preventative or emergency care due to cost. Here is my conversation with Ben Kosewski.
I'm Ben Kosewski, President and CEO for Lorain County Health and Dentistry.
Welcome, Ben. Thanks for joining us and sharing your insights. Could you provide an overview of Lorain County Health and Dentistry and your role within the organization?
Absolutely. The Lorain County Health and Dentistry is what's called a community health center, more specifically a federally qualified health center. It has a designation from the Health Resources Services Administration, or HRSA, so I'll probably refer to it as HRSA for the next few minutes here. But HRSA acknowledges certain organizations through the work they do by supporting the organization with some operating funds. We are, as a community health center, more specifically a federally qualified health center, we have obtained some funds through HRSA to ensure we remain operating to serve the underserved community. So Lorain County being a major part of where we serve patients for their health, dental, behavioral health needs. We also do other kind of specialty services here within this building. We do some podiatry. This is our Broadway location here in Lorain. We do podiatry as well as our OBGYN care is provided outside of this center as well. We also have vision here on the first floor, and we'll be opening up a pharmacy in summer 2025. We do have an operating pharmacy at our Middle Ave location in Elyria, and this is predominantly for our patients who we serve. We don't open up our pharmacy to the community as of today, but right now we serve our patients through that model. The benefit of providing the care in the community is that it's very accessible to our patients. We know that transportation is number one issue for patients in our community here in Lorain County, and being able to be right here in the community, accessible within walking distance to large populations, really helps provide that access. My role in this as the president and CEO is everything from strategic vision and direction, assisting in operational challenges, networking with our community, and also our federal and state representatives, congressmen, senators, and the like.
How many locations do you have?
We have 6 locations spread out in North Ridgeville, Oberlin, Elyria, and Lorain.
Can you talk about the value that you provide the broader community, not just those you directly serve?
As a community health center, as something that people get their health care at, whether it be their dental, vision, or just medical, what I think of it as is a way to actually lift the whole community. So if people are healthy, then they're able to go to their jobs. If they go to their jobs, they earn a wage that they're able to turn back around and provide into the community, whether it's through tax base or going out to dinner. So I feel like if you are able to keep people healthy and well, you're able to have very impactful community members to do multiple things and lift the whole community in that way.
What is something that people don't normally know about Lorain County Health and Dentistry that you'd want them to know?
I think we're Lorain County's probably biggest kept secret in some ways. It's a hidden gem for a lot of folks. I think dentistry in the name, it throws people off. It gets people thinking we're only a dental facility, and really we're not. Dental came later in our history. We started mostly on the medical side and women's health side, dating way back to the existence of this facility when it first spun off of the local health system in 2002. But dating back to the 60s, it was a medical first, and for women and women's health. So what I'd like to have people understand is we do a lot more than dental, even though dental's in the name. We also reach for folks who may not be able to afford healthcare. I want people to understand that we use a sliding fee scale, which meets them where they are in terms of the amount of money they may generate through whatever means they have, job or Social Security or otherwise. Most of our patients pay very nominal fees on their visits, but also very nominal fees if they use our pharmacy. And I won't throw out numbers because those can change every day, but really we're seeing right now on average less than $5 a script that patients are paying. We have the ability to evaluate rebates and help ensure patients get access to rebates to take their cost of their prescription down to something manageable. So as I think about what we do in the organization, we are a best kept secret, but we're going to change that. We don't want to be the secret anymore. We want people to look at us and bring their generations of family members here.
Let's go through the services that you provide and who you provide them for.
The people we provide it for, it's no different. We do everything from pediatrics through geriatrics. We don't care what walk of life you come from. We have all mixes of insurance carriers we can provide care to. Medicaid is our number one kind of payer that we reach in terms of why community health centers or federally qualified health centers exist. It's because they meet the needs of the underserved, and quite frankly, the underserved usually has a version of Medicaid in some way, which is good because it keeps them coming in and receiving their care. One note I want to mention here, and it seems like an apt place to put it, for every dollar spent at a community health center, it actually saves $2 overall on the health system. So when we think about the role we play, I never would call it cheap care because cheap would connotate something that's second rate. It's affordable care, it's accessible care, it's something that's efficiently using its dollars. So we serve the whole life spectrum from, as I mentioned, pediatrics to geriatrics to mom babies to vision and dental services through all ages as well. So really we are a one-stop shop for the multi-generational family here in Lorain County, and actually outside of Lorain County we pull patients into our facilities now.
I'm sure to deliver the services you do, there's a lot of partnerships and collaborations that you're involved in. Can you talk about some of those?
As a community here in Lorain County, we definitely depend on each other, right? So whether it be the United Way providing resources, whether it be Second Harvest providing resources to our patients, whether it be looking at how do we create these long-standing collaborative arrangements where we bring resources into our facilities from external partners. It's really just having good relationships with community foundations or other community constituents that there's a mutually benefit because we all serve the same population. The patient that walks through my door is not any different than the patient that walks through the local United Way facility that goes to WIC, that we all share in serving these populations. Thinking about the El Centro, Urban League, those families are our families. So we have to look at how do we help each other provide the right resources, because there isn't enough resources to go around for us to be everything in this community. We have to think about how do we do what we do at the expert level and rely on our partners to do the rest.
You mentioned Medicaid and some United Way funds. How are you funded and what are your different sources of funding?
So as a federally qualified health center, HRSA provides an operating grant essentially for centers of our nature. That operating grant makes up, depending upon if you want to, how you want to look at it, but depending upon anywhere between 20 and 25% of our operating budget each month in each year. So the rest of it is all on us through what we bill for the services of our patients. That generates the other 75 to 80% of our operating budget. So we are very self-sufficient in that manner. The HRSA grant was something that, as this organization first started, was heavily dependent upon. It was keeping the doors open and paying payroll and all of that stuff. But over years and years of very strategic and savvy decisions to expand and add services, that has attracted patients that we continue to serve, and that's provided us with the viability of being a very healthy entity in terms of the number of patients we serve. Unduplicated patients is how we track our patients. We have, over the last several years, been ticking upwards, and we're hitting about 18,500, just under 19,000 patients a year that we serve. That's a good lift in terms of our number of providers that we have in our facilities, but that also attributes to something almost of a 55 to 60,000 visits too. So even though it's a number of duplicated patients, it attributes to them coming in and using multiple services.
And across all age ranges, more younger, more senior?
Yep. We do everything from newborns to geriatric patients. So again, the multi-generational family can get all of their services done here. Obviously, there are things that we may or may not be able to serve at a facility, so we may refer you to another location. The Broadway location is what you would think of maybe our highest, most complex location, where we do a little bit more because we have more of the resources here, like podiatry right now. So those referrals may come to us, but we also have really great collaborative relationships going back to that question with the Mercy Health Lorain Hospital, from a birthing center to specialists. But we also have our community groups like Cleveland Clinic that are tremendous partners as well from that. What we can't do here, we rely on them to help support.
What do you see as the biggest health-related challenges specific to Lorain County?
There's many, to be honest. And recently, the Lorain County Public Health team put out their community health needs assessment. And looking at that in juxtaposition of where it was the last time they did it 3 years ago, numbers have changed dramatically in terms of direction. So thinking of like heart disease, there was good momentum going in the right direction where there was lower mortality for patients who had heart disease in Lorain County. Over the last 3 years, that's shifted in not a good direction. Cancer, depending on which part of our community you're in Lorain County, remains still at a very high level in terms of diagnoses and late stage diagnoses. Diabetes, obesity. Unfortunately, there are some pockets in our community that, because of their ability to access healthcare and good foods and in an economical fashion, that they're using Dollar Generals or drug marts for their food. Again, you can get good products at those places, but thinking about what you can get from a grocery store in the fresh fruits and vegetables, that's why things like Second Harvest are so important to our community, being able to provide access to healthy foods. But when you think about the rate of diseases and the types of diseases and the direction that they're going, it's scary because we need to be heading that stuff off at the path before it becomes a very big concern and something that's a runaway train. So not to cause chaos and despair about where we're going, it's time now to focus on things that aren't related to COVID or challenges post-COVID. We need to be thinking about things that we really were making tremendous movement on in 2020 and 2021 even. And since then, it's just been going in the wrong direction. So kind of that recommitment to going back to see your physician or provider, nurse practitioner, PA, that commitment to ensuring that you do that on a routine basis, so you're managing your care, will help turn the tide of what we were seeing at the recent CHNA.
How do you define success at Lorain County Health and Dentistry? What metrics do you use?
Focally, we have metrics that are part of our universal data system. We call it UDS for short. That measures our quality scores. So just like every big health system in really the country, we have very similar quality metrics that we measure ourselves to. So I kind of mentioned them earlier a little bit with our cancer screenings. So we're measured against how well we assure that our patients are accessing their cancer screenings. They're getting them on time. They're getting them as they should. How well we manage our patients with diabetes or our patients with heart disease. How well we manage mental health related concerns, whether it's suicide ideation and the like. So focally, we measure ourselves, and we have a measurement tool that happens every year. We review that sometimes weekly, mostly monthly, quarterly, to track how we're doing. And that way we can pivot and make some changes to our operations or clinical care to better manage the outcome there. But we look at ourselves both regionally, how we stack up in terms of the other health systems like ours, community health centers or federally qualified health centers in the state of Ohio. Or we also can back away even further, look nationally as well and say, how do we fare? We here at Lorain County Health and Dentistry are very proud of our quality care. When we look at the medals that we win as part of our scores and the performance of our providers and the other care providers and the nursing team, the care managers, it's remarkable what we do with the patient population that sometimes is very hard to get a hold of or keep consistent to their visits. So our performance here is exceptional, and we're recognized with gold medals through national and HRSA because of that.
How has technology changes impacted your work?
I'd love to say that we fully harnessed AI and we know exactly how AI is going to help us in the future. I think of when I started my healthcare journey, which wasn't too tremendously long ago, but it was long enough ago to realize that we had providers not bringing their laptops into visits. There was a lot of face-to-face interactions, and I was part of a hospital system that introduced a new AHR, and because of that, put computers in the room. And that became very challenging for the patient and provider interaction because they're used to looking at you. Now you're looking at a screen. And that was the shift of now, is this how it's going to be? And that's one step in the direction of how technology's infiltrated healthcare. It seems silly, but it is. There's multiple new devices, tools, technologies that are coming out. There's stuff called ambient listening that is saving time. That's the benefit of what I'd like to see all health systems be thinking about. How do you harness AI to help remove the burden? Because there's going to be a tremendous shift in the next 5 to 7 years. It's happening already where there's just not enough care providers. So if we don't remove burdens, we don't remove challenges off of them, there's just not going to be enough of them to go around. So how can we leverage those devices, those tools to do that, but yet understand that you can't just let it go and be free reign, right? You have to hold it tight because you are the expert and you are able to read the patient, and that system isn't going to be able to do that for you. So other ideas, IBM Watson, probably 15 years ago, was something that was put into many systems. It cost many millions of dollars, and it was thought to be this way of helping providers diagnose problems that they may have missed through assessing, whether it be diagnostic radiology or lab results, and over time to catch something. It really never presented itself well. I think IBM even shelved it because it just wasn't showing the return. However, with the explosion of AI and AI utility in a patient's health database, IBM Watson, things like that are going to become more and more in vogue to organizations to help providers screen their patients on the back end, that they're not having to do it, look at every patient result, every patient chart, but that's something that can kind of help in the background, help a patient maybe be screened and flagged as someone who may be high risk for diabetes that's going undiagnosed at this time. That's something that's like when it's high up on the shelf, you're like, that's the thing that I want to pull down and try to put into place, because it's something that would really help our providers, but yet you can't rely on it fully. You have to let the providers also act within their expertise and their clinical knowledge and clinical skill to read and understand what's going on with the patient too.
Let's switch over and talk a little bit about you. What's your background and what led you to this role?
Interestingly, healthcare has been the field of my choice since about 2011. I started my career in healthcare as a genetic counselor, so I have a master's in genetic counseling. So I started on the clinical side, helping individuals understand the hereditary nature of their disease. So I started mostly in cancer. I did a little bit of prenatal professionally, but most of my work was in cancer. So I help patients understand and their families understand, oh, is this early stage breast cancer something that was more nature or was it more genetic? And being able to help those patients understand, was their children, their brothers or sisters, their mom, their dad at risk for a higher risk of breast cancer or colon cancer or whatever it may be. That was the field I went into, and it really got me into healthcare and thinking about healthcare as a career. I love the work that I did. At the time, I saw that I wanted to do more than the one-to-one interactions with our families or patients, and wanted to expand my career, and was given the opportunity to quickly move into kind of a healthcare administration role. I moved in Seattle. I worked in a cancer center there for 3 years, managing kind of all the aspects of oncology, practices and care, helping to do some work related to a very large $20 million cancer center rehab, taking over one of the hospital's floors to make a whole cancer center in. And from there, it was just next step after next step to advance my career, mostly in cancer. And this is a foray outside of cancer in terms of the care that we provide here is not anything oncology related, but yet really on the more preventative medicine, primary health care side. Moving into the world of healthcare has been very fulfilling in terms of being able to really help a community and provide services and provide resources to the care providers. Let them be the ones to really advance the care, but by way of removing the barriers and providing them the right resources to do that.
Is this position what brought you to Lorain County?
It isn't. I've been traveling back to the Cleveland area for better parts of 15 years now. My wife is from Lakewood, Ohio, as I've moved her all over the country for career advancements and job opportunities, and really just to be able to experience life in different parts of this country. We in 2020 moved back to, I say moved back because we never really left Lakewood. We were always traveling back and forth every holiday and every summer. But moving into Lorain County about in November of 2020, I don't advise anybody moving during a national or global pandemic.
Right. Good
Stay
timing.
clear of that if you can. But realistically, it was a great move for me and my very young family at that time. I have 2 boys who were school age, and it was a good time for us to move and relocate and settle in Avon Lake, which has been a tremendous decision. But working for healthcare entities in the greater Cleveland area and beyond, I'm very attuned and very well versed in what's going on here in Lorain County. This is my home now. This is where I want to raise my family and really do some amazing things with the board of directors that I have here at Lorain County Health and Dentistry, as well as the senior team and providers. This is a tremendous team to take the reins from Stephanie Wiersma, who's the founder of this organization 23 years ago. There's a tremendous legacy here of great, exceptional care, and I've been very proud to step into this role and been quite honored to be the successor, which, if you think back to the start of my professional career, it's a little bit outside of heavy equipment operating and construction, but healthcare was really, I think, a passion for me to move into. And again, it's been a very fulfilling career.
You've been here about a year?
No, actually less than. So I worked alongside Stephanie for 6 weeks in early 2025. So I started in January, and she officially retired at the end of February. So I stepped into the CEO role March 1st.
Okay. Congratulations.
Thank you.
Going forward, what are your personal goals? What do you hope to accomplish here?
So we are in an exceptional time for this organization, being that we have a 3-year strategic plan on the horizon. So this is a really great time to jump into an organization where we can step back and say, okay, how do we want to achieve greatness? How do we want to touch more lives in this community? What services do we feel we need to really ramp up? What services we really need to focus on in what parts of our community? So that's where the strategic plan is going to be very important for us. But I see this time too with what's going on the state level and the federal level in terms of changes potentially with Medicaid as a period, a bit of unrest. We may be seeing where patients are coming to us saying, am I going to be able to come see you? Am I going to be able to get my care here? I really want people to recognize that's what we're here for. We're here for our patients. And regardless of what's going to go on at the federal level or the state level in terms of changes with insurance and Medicaid, we're here for our patients. We're here to care for our constituents and our communities. So we advocate constantly with our representatives, either on the state level or federal level, to ensure that they hear our voice, the voice of the patient. But I really want people to understand that what we're trying to do here at this organization is build upon that great legacy, the great care, and take it to an even higher level where we are meeting the needs of our patients. So really looking at the work that is done by other community members and saying, where do we find something missing and how do we really turn that up?
Outside of work, what are your hobbies and interests, and how do they help recharge you?
As you might imagine, this is a job that you don't ever shut it off. It's a career of caring for what's going on in our community 24/7. And I enjoy the work that I do, which is great. And I wanted to find a career that did that. But also there's times you have to walk away and just clear your brain. So being able to spend time with my family, my boys are in Boy Scouts in Avon Lake. Stepped into a leadership role with PAC 334 as their Cub Master. So being able to go out, touch grass, as they say, get outside, spend time helping train to 70, 80 Cub Scouts that alongside of me and the other members of the leadership team, just to get out and do something different. Get out in the wild and wilderness and clear your brain and get into nature for a while is always fun. I do a lot of woodworking. It's also a creative hobby that you can use a different side of your brain for. It's also nice to visualize something, bring it together and put it together. And I do that just as much of a hobby as well. But really exploring greater Cleveland, even though I've been coming back to the area for 15 years, you don't really get the chance to see it all. So being able to spend time going around to Lorain County, I still find new stuff all the time, but also getting into Cleveland, and whether it be Browns or Guardians or Cavs games, being able to spend time downtown and enjoy that with family and friends.
A couple of years ago, we actually took a vacation to Cleveland, booked
Okay.
a hotel, and
Love
did
it.
it as a tourist just
Love
to
it.
see the things you don't think about because
Yeah.
you live so close or
Yeah,
too.
it's different being able just to wake up in the morning and be like, all right, I could walk to this local whatever it is, and that would be different than if I drove down here and tried to find parking. And
That's exactly what we did.
yeah.
Finally, where can people get more information about Lorain County Health and Dentistry and connect with you?
For more information, you can just go to our website. It's heavily accessible, easily to navigate, whether you're on mobile or if you're on a desktop, to get around and get information about our facilities, locations, hours of operation. The good news is most of our hours of operation are all the same, no matter which facility you're in. We do have nights. It just rotates depending on which location. And keep us in your socials as well as you look to subscribe. We're on LinkedIn. We are on Facebook and Instagram. Those are great opportunities to just get some more information in terms of healthcare. We do a lot of posts about what month it is, whether it's Mental Health Awareness Month or Colorectal Cancer Screening Month, those sorts of things. We always try to put posts up just to get people thinking about their care. If we have anything new, especially when we have congressmen or representatives or local groups coming through and viewing our facilities, we always put posts up welcoming them and sharing that good news as well. So our social media is very robust here. We try to push out as much content as we can, as quickly as we can, as much about us as we can. Those are the best places to find us.
Thanks, Ben, for your time and sharing your insights.
I appreciate you having me on. It's been an enjoyable conversation. If you have any questions, don't hesitate to reach out.
Thank you for listening to the LorainCounty.com Insights Podcast. Each episode, we share conversations with the people shaping life in Lorain County, from business and government to education, nonprofits, healthcare, and entertainment. Be sure to follow or subscribe on your favorite podcast platform so you never miss an episode. You can also visit LorainCounty.com to discover local events, volunteer opportunities, and more community resources. If you know someone who's making a difference in Lorain County, send us a note at podcast@loraincounty.com. We would love to share their story and insights. Special thanks to our producer, Leah Gerke, and to you for listening. This has been the LorainCounty.com Insights Podcast, conversations with the people shaping Lorain County.